you have a problem with being recorded, please um, turn off your camera. Otherwise, we love to see your smiling faces. Make sure your Zoom microphone is on mute. If you do want to ask a question, and again, we encourage you to make this a dialogue, to ask a question, unmute yourself at the appropriate time and go ahead and ask that question. And let's keep this conversational. If you have audio issues, join by phone and be sure to mute your phone. Type your name and your affiliation in the chat box so we know your name. In fact, make sure your name is both first and last in the window so that we can put that in the raffle. Check your name, rename it if necessary. And if you have any questions, as I had mentioned, again, you can put them in the chat feature. That's sometimes the easiest. I'll be facilitating bringing those questions to Dr. Alex, or you can unmute yourself and keep it conversational. And again, this network of care that we're building, we want to keep this very familial and have people know each other and get to know each other, which is an important part. We're going to be doing some introductions after our presentation. Again, it's great to see your smiling faces and to put a face with a name. So if you feel comfortable opening up your video box, that would be great. We went through our grantee collaborators. If you have any questions at all, please don't hesitate to reach out to any of us. Our ACES Wear Kings collaboration is supportive and helpful in terms of any way we can help you disseminate ACES material. We can do presentations, we can get our information out there to keep the momentum in this going. And again, the collaboration has been working very hard in the last 6 months. Very proud of the work that we've been doing, and we want to continue that. So on that note, we are going to start. I'm very honored and very proud to introduce Dr. Alexandra Adobotneg. And I'm sorry, I don't mean to butcher the last name. Dr. Alex has received her doctoral degree in education counseling psychology, a master's in marriage family counseling, and a BA in business management. She serves as an adjunct psychology professor at Fresno Pacific University, board member at Neighborhood Industries, a local social enterprise, as well as the board president of the National Alliance on Mental Illness, Fresno Madera County, as well as being a California Health Collaborative employee. We're so very proud to have her as part of the collaborative. Over the past 7 years, Dr. Alexandria has provided clinical, individual, and couples therapy addressing perinatal and paternal wellness, preterm birth, traumatic birthing experiences, and adverse childhood trauma that resurfaced during the perinatal phase of parenthood. Also, Dr. Alex serves on the Fresno County Local Outreach to Suicide Survivors, the LOSS team, offering grief support services to families and friends after suicide and loss. Dr. Alex serves on 4 patient-driven projects at California Health Collaborative, thus encompassing complex case management and perinatal mental health. As the Director of Perinatal Mental Health Services, Dr. Alex's area of expertise is educating community providers and leaders on the multi-generational impact of perinatal mental health disparities, social and cultural implications, diagnoses, and treatment, in addition to program development. At California Health Collaborative, Dr. Alex continues to focus on systems change, therefore closing the gaps in maternal, paternal, and infant mental health. So without further ado, I would like to turn this over to Dr. Alex. And if everybody could unmute yourself and please give Dr. Alex a round of applause.
Thank you, George. Thank you for having me. So as George mentioned, and a lot of people on this call I do know, I don't like to talk. And so if you want to speak up, ask questions, I like things very conversational. So please join in on the conversation. So thank you. So go ahead and change the slide. So today we have 3 goals. We are going to discuss what is perinatal mental health, both for moms, babies, and fathers, and how that impacts them. We're going to talk about the overlap between ACE, so adverse childhood experiences, trauma, in regards to perinatal health and wellness. And then we're going to talk about the lifelong impact on babies, social, emotional, and cognitive development. And again, please speak up, ask questions, bring your experiences to the table, because I honestly don't like to hear myself talk all the time. I like to hear your guys' thoughts and opinions. So go ahead and change the slide. Okay, so overall, when we're pregnant, the ideal is that moms are happy and it's a joyful experience, but a lot of us know about baby blues, right? So between the first, from birth until the first 2 weeks, women will experience maybe different emotions that we consider the baby blues. After we hit the 2 week mark, if we're still feeling depressed, anxious, or overwhelmed, that's when it can be assessed for perinatal mood and anxiety disorders. Now, most of you guys are familiar with this diagnosis as postpartum depression. Why do you think that we are terming it now as perinatal mood and anxiety disorders? Does anybody have an answer?
Is it because it can happen at any time?
It can happen from the moment of conception. And hello, Teresa, I'm glad you're on the call. But no, that's not it. So perinatal mood and anxiety disorders. When you think of a pregnant or a postpartum mom, what do you think of? What's the vision that comes to your mind?
This is Patty. For fear of making sure that the needs of the newborn is fulfilled for the rest of the life, and I think with a lot of uncertainties that's currently going on, it does put a lot of anxiety for a woman. And plus the physiologic changes in immediately after postpartum delivery associated with estrogen and progesterone.
Hi, Patty. How are you? Yes, that's exactly correct. It's more of an anxiety disorder, especially here, like Patty had mentioned, with COVID and throughout the Central Valley, as we're seeing more and more moms come in for treatment, it's less depression and more anxiousness. Go ahead and change the slide. Again, like we had mentioned, it can happen up to the baby's first birthday, so the moment of conception until then. We also have to take in consideration the moms who breastfeed. So we say the first birthday, but let's say, for example, we have a mom that's breastfeeding until the baby's, let's say, 18 months. The onset can be on the moment of the breast milk. The mom stopped breastfeeding because there's a hormonal change, and we'll show you that slide as we move forward. So overall, it's emotional distress. Affects the relationship between mom and baby, right? And affects the relationship between mom and her partner or any other children within that family system. Go ahead and change the slide. And George, if you see comments up in the chat as I move along, feel free to just go ahead and shout them out so we can have it more conversational.
I sure will. And again, I encourage everybody to unmute yourself and turn your camera on and include your thoughts and comments in today's discussion.
So about 1 in 5 women suffer from a perinatal mood and anxiety disorder. And that was, again, pre-pandemic, and that was only the moms that reported, right? So, as you guys, most of you know on the call know about stigma, not all moms report. Less than 50% take an antidepressant. Also, a lot of research has shown that taking an antidepressant during pregnancy or after pregnancy can be the best treatment of care when we're looking at the impact of cortisol on the baby. And Patty could tell us more about those antidepressants during pregnancy. Next slide. So the ideal with perinatal mood anxiety disorders is we are similar to the ACE project screening at the medical offices at their medical home. So what we do is we encourage our OB providers and pediatricians to screen moms for this complication. It's the #1 complication. But the issue with perinatal mood and anxiety disorders is the mom is pregnant. So the psychiatrist was a little hesitant on writing the prescription, being that the mom is under OB care, and the OB care is not a mental health provider. So, we've started on this journey since 2012, and, we're 2021. Here in the Valley, we have more OBs willing to start them on medication because they understand the traumatic impact this has on baby and the family system overall. Okay, next slide. So what are some symptomologies of perinatal mood and anxiety disorders? Usually the mom will isolate herself. She thinks that she did something wrong. The major issues is where it's psychosis, where they're hearing voices or seeing things, but really tearful, lack of energy. They're just not themselves. And again, ideally, most moms, we're a society that believes that, during pregnancy is the happiest time of your life, and that's not necessarily so. Next slide. Risk factors. So history of ACE scores, a high ACE score themselves. So exposed to toxic stress throughout their lifespan, because once they become pregnant and have a baby, that could be a trigger. Their hormones do shift. Family history of mood disorders, substance abuse during pregnancy or after pregnancy, partner violence, just the basic stressors, right? Infant illness, preterm birth, prior pregnancy, stillborn birth. Those are all risk factors. But the one thing about perinatal mood and anxiety disorders is that it can just happen. Right. So maybe this mom was excited about the baby, having pregnancy, maybe, income is great, marriage is intact, but they still can have a perinatal mood and anxiety disorder. Next slide. And here's why. I love this little diagram here. It's one of my favorites. As I mentioned, 1 in 5 women suffer from this disorder. Now, if you see in the purple and the blue, from a moment of conception, our hormones, they shift up. At the moment of conception or in the moment of birth, they plummet. Now that just kind of makes sense, right? It kind of takes away the fact of, oh, I'm doing something wrong, or, I'm not connected to this baby, to where it's more of it's hormones within my body that have shifted. Now, when we breastfeed, the nosedive at 9 months kind of tapers off a little bit slower, but there's still that shift. Does that make sense? Does anybody have any questions? Anything in the chat? Okay.
Can you explain a little bit about the difference between what estrogen and what progesterone does to mood?
Yeah, so estrogen and progesterone, they are, our feel-good hormones. And then there's also oxytocin, which is not on this slide. But again, they are our happy hormones. And so when we have this huge plummet, again, our serotonin is going to plummet, our whole body overall, our hormones are just going to shift too rapidly. And again, I don't think this is on the PowerPoint at all for this presentation, but we also talk about birth control. Sometimes we'll notice that moms who start birth control right after pregnancy, they'll be thrown into a perinatal mood and anxiety disorder, because that's our system that kind of regulates our mood. Okay.
This is Patty. May I just add, that's exactly right, but I just want to add a little bit. During the pregnancy period and during the developmental phase, estrogen and progesterone are absolutely critical for the maternal well-being as well. Estrogen remodels the vasculature. Progesterone actually, in the sheep model, that precipitous drop that you see in the sheep is actually what starts the labor. But in humans, that drop of the progesterone is not actually involved with the preterm labor. But what we do know is that progesterone is absolutely essential for pregnancy quiescence, to make sure that it doesn't go into labor.
Thank you, Patty. Next slide. Fathers also are at risk for perinatal mood anxiety disorder. We are now seeing more and more men come forward, which is great. We're doing more work in our communities to really educate and promote screening with dads. Moms who are experiencing a perinatal mood anxiety disorder, the father is at additional risk. It's at 50%. So typically, if mom's depressed, you're going to most likely see dad depressed at a 50% rate. Now, if mom isn't depressed, it's less likely that the dad will be depressed if there isn't any external factors. Does that make sense? I don't know if I said that clearly or not. Okay, next slide. So about 25% of new dads have been identified as at risk. They're calling it the dad blues. If, again, similar to mom's or any other mental health diagnosis, if it's not treated, it can escalate to additional mental health complications. Next slide, George. So dads, it looks a little bit different. There's that isolation piece, but typically there's a lot of anger. Excuse me. You will see them maybe check out, work more, those types of behaviors, maybe not feeling connected to baby, which is similar to what happens with mom, but really just checking out of that family system. Some marital discord, those types of things. They too are at risk for suicide and self-harming behaviors. Next slide. The overlap between maternal paternal ACE and the perinatal mood disorders. Go ahead and switch the slide. So we're going to look at toxic stress. So as we are going to discuss here, when a mom is, developing a fetus in her uterus, I say, oftentimes tell our moms, you're growing a human in your uterus. When there's a lot of stress that the mom is encountering, that has great impact on the infant or the fetus. It changes the gene expression and how it develops overall. And so it can disrupt the immune system, hormonal system. There's just long impacts. So it's not just, that one event. These are lifelong impacts it has on both mom and the baby in utero. Next slide. So stress response system. So we know now that when you're undergoing a lot of stress, we oftentimes look at, how is our body responding? How is that baby responding? Now, although we talk about perinatal mood anxiety disorders and how it can impact the baby, if the baby undergoes a lot of stress and then the stress response is that the mom, has progressed in her mental health treatment and is now, attaching to baby, then the bonding and attachment between mom and baby can be repaired, right? They then become, one system. And I think in our next slide, we are going to talk about kind of the regulation system between mom and baby. So from there, baby will attach, and things will move on. Now, tolerable stress, it's short term. Let's say, mom and baby have to move. That would be a great example of tolerable stress. Now, yes, it impacts baby. Yes, we can put some buffers around mom and baby, and then, mom and baby will be okay. Now, toxic stress is more prolonged stress. And that's when we're going to see the expressions, the changes in the DNA. That's when we're going to see impairments in cognitive development, impairments in emotional development. So we're not talking about just mild stress. So that was one thing that I really want to get across to you, because when we look at perinatal mental health complications, it's 1 in 5 women. So I don't want us to walk around thinking that, oh, if I had that, then it's doomsday for baby and mom. Does that make sense? Next question, next slide. So toxic stress and trauma is, so if there's a personal history of toxic stress, so meaning that there's stress that this person has undergone for long periods of time, it can impact their immune system, their cortisol levels, and inflammation. Now, when we're looking at mom, when there's toxic stress, this can lead to preterm birth. We want to be mindful of that. We want to be mindful of low birth weight babies. Toxic stress really impacts the baby and the mom at all different levels. But if the baby has already been born and the mom is attempting to breastfeed, sometimes what will happen is the milk supply will dry up. So that impacts the baby. And I think our next slide has cortisol on it, but the cortisol does cross the placenta barrier. So therefore the baby is feeling those hormones. So when we're looking at discussing with a mom, you know, shall I take an antidepressant or should I not? Sometimes it is appropriate to discuss how cortisol impacts the placenta, because it does enter the barrier of the wall, right? And how does that cortisol impact the infant? So at birth, they're easily startled. There are, you know, you can see that the baby has been exposed if it's extreme toxic stress. Next slide. Here are some, you know, some basic breakdowns: lower birth weight, decreased blood flow to the placenta, miscarriage, gestational diabetes, preeclampsia. But here in the Valley, we really worry about preterm birth. We have a very high rate of preterm birth. Any questions so far? You guys are such a quiet group. Patty, do you have anything you want to add?
No, you're doing a great job.
Thanks, Patty.
Dr. Alex, is cortisol always a bad thing?
No, it's not always a bad thing, but if we have high levels of cortisol, it is a bad thing. Patty, did you want to add something?
No, I was just going to say that cortisol is absolutely critical also for brain development in neonates, or I'm sorry, in infants. And so as far as cortisol, you know, with potential sustained toxic stress response, there could be some difficulties at later on, but at this point, cortisol from an endogenous level perspective is also absolutely critical for brain development and also just the overall well-being of the infant.
Thank you, Patty. So earlier today, George and I were thinking about that slide that you have, actually, I think I saw it from you, where the MRI of the baby and the hippocampus is smaller due to toxic stress. Yes. Next slide. So here's more information on the cortisol. Oops. You want to go back one, George? I think we kind of went over the basics of it. Brain development, the programming, right, of the fetus's immune system. And that's, again, we really want to look at, some meditation, some mindfulness to really relax mom during that time. Go ahead and change the slide. Go ahead and just push it all the way through. Okay, so this is discussing the epigenetics of stress, right? So perinatal maternal distress. So you see that there's the baby and the fetal development, because it does change the baby's DNA, right? So even after birth, though, so if we have a child that undergoes a lot of stress, again, we don't have the slide, which I really wish we do, but we'll see it in brain development with an infant, toddlers, that their brains, the hippocampus is smaller. So we really want to make sure that mom and dad their health is intact, because we're putting the child at risk due to the toxic stress. Go ahead to next slide. Intergenerational adversities. This is kind of the same concept, but in a different form. So we see that the parents' toxic stress to the left, and then the stress hormones, right? And then we see the immune system, the parental factors. Then it goes on to conception and postnatal factors, right? So we kind of see it move through its course right there. Now, when I'm working with OB providers, we are constantly reminding them that if we address the mental health of the mom who is pregnant, that overall her delivery will be, healthier. Because whatever stress that, our body's going to feel the outcome of that. Whether it's, she's making additional trips to the doctor's office to access care, whether it's, she's bringing the baby to the pediatrician to access care. That's how it's going to present itself. Okay. Next slide.
And just as a note, check the chat feature. Linda posted something. For more information on the intergenerational transmission of adversity, please see the Surgeon General's report, refer to page 36. The link is provided to you there. So in case you need more information on that. We'll be talking more about the Surgeon General's report at the end of this presentation.
Very good. So we are finding the sex differences observed in attachment. So when a mom is suffering from an attachment disorder, and it could be because of stress, toxic stress, it could be because of perinatal mental health. And we have observed in research that boys are at greater risk of experiencing the anxiety and depression. We don't know exactly, how this is transmitted yet. But we do know that when a mom's mental health is an issue, or she's experiencing adversity, we do see that it's being transmitted to the child. So again, from birth, from the start, they're having an adverse experience. Okay. Go ahead and, so during the first few years of life, as you guys know, 0 to 5, the child they're building their emotional regulatory system from the beginning. And so when mom has experienced a lot of trauma, again, that's going to change how the child navigates relationships, and then attachment is impacted, right? Next slide. So this is more about the baby. So social, emotional, cognitive development, and how does ACE or trauma impact the baby? So the experience of an adverse childhood experience during the first, 5 years of life or in utero, what can happen is they have difficult in romantic relationships, building secure attachments, um, and then just moving on and navigating life. Now, why this is a big issue in the school setting for our cognitive development piece is if our students are not able to form relationships with their peers or with their teachers, then they're at risk for behavioral problems. Next slide, please. Again, attachment is formed in the first years of life. It's between the care provider and the infant. So if there is stress in the home, what is the outcome of the baby? The ideal is that most babies have built a secure attachment style. Again, if mom is anxious, depressed, if there's a lot of stress within the home, that is hard to build. Okay. Any questions so far?
I think just one comment that I wanted to say is that you could have a strong support system around that child and that mom, but if they continue to have those symptoms, obviously child will mimic what mom is going through. Even if they have a healthy individual around, it's just that you only need one healthy individual in order to have that social attachment. But if mom is not being taken care of, then baby will continue to have that. So, I mean, just a very key important thing that we want to bring across to our families and our moms when we're talking to them.
Yes. So in other words, if there's grandma, any sort of care provider in the home, that helps build attachment and helps build the social emotional components of the baby while mom seeks help. Next slide.
We have a question here from Carson Gordon. Carson, I'm wondering if you'd like to unmute yourself and ask your question. Give us a little bit more detail about your question around COVID.
Yeah, sorry. I was typing that as she was speaking before she asked for questions. I was wondering with this screening for ACEs, and you're talking about relationships, being affected, with schools closed, with a lot of kids on distance learning. And for example, all of us not in a room, we're all on, working virtually. Or, for example, me, I'm in an office, but we're very contained in our work areas. How does that affect, what we're seeing in screening? Or, should we parse out what is long-term rather than COVID, or should COVID be included in that, in those concerns?
That's a great question. And I would almost say that COVID is a part of those, concerns. This is going to have lifelong impact on, my area of expertise is perinatal mental health, right? But it's going to impact everybody. It's going to impact our adolescents. It's going to impact, sending our kiddos back to school is going to be an issue, right? The isolation, the fear, and going back to perinatal mental health, even delivery of a baby right now, it's not the typical experience, right? So only one person is allowed in the room. And I don't know how many of you have children, but usually when you have a baby, you have a baby shower and people come over to visit the baby. And, we try to make it the best celebratory experience that we can. But with COVID, obviously we aren't able to do that. And obviously we don't want our baby to get sick. So the anxiety that this baby is experienced from the moment of conception, just because of COVID, our referrals are ridiculous right now. Does anybody want to add to that?
I do, especially because I primarily work directly with moms, and And we're just going to see how we are going to label, I would say, like a COVID babies, COVID generation, that we are going to see, and how these kiddos end up manifesting the levels of depression and anxiety. Because, one of the things is that when moms are experiencing this, they're already isolated as they are, and now adding more layers to it, it just brings an overwhelmness. And the majority of them is like, their safety is important, but their primary goal is to make sure that child or their pregnancy is safe. And so, their anxiety is up the roof. And so talking about toxic stress, that those cortisol levels are not in any way coming down whatsoever, because, they're in a stage of fight or flight, right? So we do have to be able to create a situation where we are able to regulate, moms or pregnant women's symptoms during this time, and see, what are their strengths and what is it that they're really able to work with and control, so that those symptoms are able to minimize, thus being able for their pregnancy and or their postpartum recovery go a little bit much smoother. I just wanted to add that.
Thank you. So there's going to be impairment of our executive functioning. Our kiddos are probably not going to start, preschool, kindergarten at the rate that they probably should have. So we add not only the perinatal mood anxiety disorder, then we add the COVID, then we add the toxic stress of all of those combined. Go ahead, next slide. Go ahead, next slide. So we're going to look at resiliency. So I hate for anybody to walk away from our presentations as if, it's very sad. It is sad, but there are ways to mitigate some of the trauma. There are ways to address it as we encounter these moms, babies, and fathers. So the one great thing about perinatal mental health, and I think that's what keeps me kind of grounded in, that population. It's a population that typically wants to get better for their baby, right? And the treatment options are usually pretty quick. It's fairly quick. So if they start medication, if they start therapy, whatever their treatment plan is, usually the recovery rate is quicker than other mental health complications. Okay. Next slide. The biggest challenge with this population is that asking for help, right? So as I presented at the beginning, perinatal mental health it's complex, being that, we're a society that says when you have a baby, it's the happiest time of your life. I think that at the collaborative, we do a great job of saying, okay, but yes, it might be the happiest time of your life, but it's a stressful event. It's a lot of work, and really drilling down to what it looks like having a new baby in the home. Okay. We encourage our moms and dads not to suffer in silence, and we encourage to decrease stigma. Now, we do that at the hospital level a lot in regards to social work, because we don't want our kiddos to be removed from the home because mom is admitting that she's having a mental health complication. Asking for help, we should not be punished for that. We should actually be applauded, and as professionals, we need to create a treatment plan to help resolve the toxic stress that's in the home, or help prevent any adverse childhood experiences. Next slide. So a lot of times what happens is that, when we have a baby, the priority is set towards the baby versus the mom and dad. And we want to encourage you guys as community leaders to shift that lens. So really make the priority the mom and the dad and their wellness, because that's the quickest approach to not allowing our infant to experience an environment that's full of adversity, right? So we want to make sure mom and dad are healthy, then baby will be healthy. Any questions in regards to that? Some ways we can do that is increase mom and dad's self-esteem. Encourage them, really help them unpack what it looks like to have a new baby in the home. Unpack, the pressures of having a baby in the new home. Unpack the stigma around that. And really supporting them. So what will happen sometimes is we'll have maybe the mom who wants to breastfeed, but maybe grandma is saying let's give her formula, or vice versa. Really look at the fears associated with that and really empowering the mom. A lot of times if there's two parents in the home, the partner does want to help, but they don't know where to begin, and the mother doesn't know where to use her voice and say, I need help in this area. Now, we want to create the environment that's going to be the most healthy for this baby. Next slide. So when we're working with families, we want to ask them, what did wellness look like prior to the pregnancy? What were some things you did when you felt well? Right? And really make that assessment. And if they don't have an answer, maybe you could even go back to childhood. What did it look like when you were well? What are some things you did? What are some things you enjoyed? And then build that with them. Again, the reason why we need our moms and families to be well is so the baby will be in the less stressful environment as possible. Stay positive. Although, we are in a situation of the pandemic right now, there are a lot of positive things that we can highlight for families. Okay, and promote conversations. Yes, so screening. So the screening tools, Julie, that we push into OB providers and doctors' offices and schools and where have you, because mom and baby faces, all different entities these days, well, pre-pandemic, is the PHQ-9, which is the Patient Health Questionnaire, and the Edinburgh. In our other county that we work with in Stockton, we are pushing in ACE screens at the same time as we're pushing in our APDS and PHQ-9. I think that that's the best way to capture mom. Now, during pregnancy, it's a time where families are eager to shift or change, especially the female in the home. So I think it's ideal to really just drill in and make a holistic assessment. We also do the GAD-7. In some areas, we also work on suicide pieces too. I think that's more Fresno County. Next question. Oh, in Madera County, we're also doing a substance abuse screen.
But Alex, if I can just ask a quick question, but is the education being given at the same time of the screening?
Correct.
Do those screenings come with education as well?
Correct. You might not have seen our book. We have a pretty robust flip book that the medical assistant utilizes, and it goes over ACEs, it goes over SIDS, it goes over car seat, like every aspect of mom and baby to kind of make this the most safest environment. It's like a little flip book that they go over.
Okay, I just the reason I ask is that I just had a baby during COVID, my own COVID baby. And I remember each baby that I've had getting those screenings. I remember the screenings very well. And I couldn't remember if there was information on the actual screening, not like a book of information that you take, but information on the actual screening itself, or if there's not supposed to be educational information within the screening. Does that make sense? Not educational information outside of the screening, but on the physical screening itself. Because I just feel like those screenings it can be obviously be fudged, right? And so we can convince ourselves that we're not feeling a certain way. and understanding the importance of recognizing feelings in the relationship to your baby is, I think, something that, I don't know, I kind of want to call, I'm like, did we call that out on
Yeah.
screenings? Because is it called out more? Because I feel like I missed that.
No, yeah. So to answer your question, on the screen itself, there is not education. What we have
I
done
don't
is
think so.
we've given them the screen. We've trained the nurses and the staff on how to talk to the mom. Not, I can't,
Mm-hmm.
they all do that. But there's a second sheet of information that goes over some basics of perinatal wellness, right?
Mm-hmm.
When those screens come into our office, even if there are 0, we call them, because you are right. There is such stigma associated with perinatal wellness. It is
Mm-hmm.
amazing. So then our care navigators would then call the mom and just ask, how was your delivery? What's your baby's name? And just have that
Oh.
conversation with mom and just offer her resources and let her know that she can come back at any time. Because we're not always in a space where we want to admit that we don't feel well, or we don't want to admit
Mm-hmm.
that we're attached to this baby, or we like the baby.
Mm-hmm.
And so we really just want to encourage honest conversations around that.
Wonderful. I didn't think it was I wish it could be attached. I get that it can't, but I remember, I just know from my mindset, I remember the screening so well, and I don't remember anything else that went along with that. So, but that's something we'll continue to fight and make sure people see page 2. There
Yes,
you go.
so important, Julie. And similar with the ACE screen, like we don't anyone ever want to have someone complete a screen and have them walk away not knowing that there's answers to the screen.
Mm-hmm. Exactly. Exactly.
All right, next slide, please. So a daily maintenance plan. So let's say that mom's, just struggling with breastfeeding. We want to encourage her to have a daily maintenance plan, identify triggers, identify early warning signs. Now, why is this all important? Again, because it can impact the baby's emotional state, right? Next slide. Factors to consider. Seeking support. So the great buffer with perinatal mental health is community. And I guess that would be for all mental illnesses, but with perinatal mental health, it's really good to get them out of their isolation if possible. Now, I know that's hard with COVID, but there's ways around it. You can do virtual support groups, there's mommy and me groups, and maybe they just need a girlfriend to have coffee with. It doesn't necessarily have to be a therapist. It's really just, having community outside of this baby and normalizing the fact that having a baby is hard work. Next slide. What we do at California Health Collaborative is we really promote that, if you want to be resilient for your baby, that putting the mask on yourself first is okay. Moms struggle with that. Moms believe that, caring for their baby is what they were, supposed to do. So let's care for the baby and lose sight of their own wellness. But that is not a true statement. We need wellness for mom and dad. So then the baby has the best childhood experience. Any questions about that? So resiliency, it's the ability to withstand and recover stressors, right? So we all know that something's going to happen in our lives. That's just life. But it's the ability to bounce back, to recover, to be able to process that experience. Next slide. 7 C's of resiliency. So it's the ability to handle the situation effectively, right? Like being able to just sit in it for a second and say, how am I going to address this? Having confidence, right? Building connections. Now, this is in the lines of children, but this goes with adults as well. And having a sense of self, knowing that the decisions and choices that you make are good choices and having confidence in that. Now, there are some more C's that we're going to get to on the next slide, but I just want to say when we're looking at perinatal mental health, when do you think that we build these characteristics? Does anybody know?
How about every day?
Every day, but in our early life experiences as well, right? Next slide. So we want to know that we contribute to society, right? As children, they need a space. So whether that's, in your home, in your classroom, but just contributing to society overall. They're able to cope. Now, again, with perinatal mental health, we learn to self-regulate during the first 5 years of life. So if mom is not well, we do not learn that skill to self-regulate. And self-regulation is usually the underpinning of a mental health disorder. And control. We need to have control of ourselves, our behavior, our feelings, our thoughts, and our emotions, right? Again, if we live in an environment filled with toxic stress, we don't learn how to effectively cope, contribute, and control ourselves. We don't feel like we have control of our environment, and we don't feel like we're contributing to society or a school, home, what have you. Next slide. And this just goes over basically the ability to bounce back, right? Now, I really want you guys to walk away from this understanding the connection between toxic stress during utero and during the first 5 years, and how adverse childhood experiences, the interplay between that and perinatal mental health. Now, as you guys have heard over the years, the first 5 years are the most crucial. We're building, our ability to think, we're building our ability to attach. Those first 5 years are crucial. So we are in an environment filled with toxic stress. We won't learn how to be resilient as adults. Next slide. Again, this is resiliency. So some basic components of resiliency, it's survival skills, recovery time. We also want to just be able to thrive in our environments, right? And I love this definition. Thriving is going beyond his or her original level of functioning, right? So we don't want our mommies to just live and our babies to just live. We want them to thrive. We want our families to thrive. And we want them to have the best experiences possible within the pandemic, with having scores of ACE. How do we use that information and spin it to a resiliency model to where they are stronger individuals and they're producing stronger babies? Next question, slide. So I go back to there's no such thing as normal, right? So we oftentimes learn that, maybe you need to have your house in order. Maybe things just need to be perfect. I think that that's what, women are taught as a society. But really, we just need to look at things as they are, right? How many times have we walked into a room and the baby has, created a mess like this, or colored on the white couches, or spilt juice, right?
Alex, that looks like my boys' bathroom every day. I thought that was normal.
Good. I love it. But these are moments that we don't need to have it filled full of stress. It just is what it is, right? Because allowing the children to explore and play and things like this that, look crazy, it really builds those resiliency components. Next slide. Realistic goals. So setting some of those. Some of our moms will have, these far-fetched goals, and I always say, when are you going to sleep, right? Because when the baby's sleeping, the mom should sleep. And then accept help, right? And if you're not accepting help for yourself, then you're accepting help for the baby. Next slide. So we want to teach our families to nurture themselves, and that it's not selfish. Keep things in perspective. and maintain a hopeful outlook. We also discuss visualizing what you want versus sitting in a space of what I can't have, or, I always say that doomsday approach, right? Or, or looking at it in chapters, right? So a baby's only going to be a baby for so long, right? It's a year, then each year gets easier and easier. So when a mom comes in and she's very stressed and overwhelmed, you can't just chunk it down for her, right? Next slide. So the heart resiliency during the perinatal phase is strength and support, meaning and purpose, optimism, and pleasure. So again, I hope that today you guys have made the connection between ACE, adverse childhood experience, and the very significance of perinatal wellness, and that the fact that mom, dad, and baby both need to be happy and well for us to have happy and well children. Any questions? Okay, George, do we have any questions in the chat box?
No questions in the chat box at the moment. I'll encourage anyone here, if you do have any comments, questions, or have anything that you'd like to put out there to either Dr. Alex or the network, please unmute yourself and speak right up. Selena?
Hi, this is Lupe Wong. I just thank you for the presentation. So this has really been this has been really affirming for me. I personally went through a premature birth 18 years ago with my child, and I remember distinctly the toxic stress I was going through at the time, and remember telling my provider that I really thought this was all stress related, and at that time they just put me on, you're crazy, like that's not what's happening here. So to see where we've come full circle, and it's just ironic, I'm also the ACEs lead for our company right now. So this is really, this is big. I think there's a long way to go though, before we, I'm looking at the sort of the group of people who are on the call. I don't see a lot of MDs, I see only a couple, and I think we have a long way to go to really get the MDs of the world to really understand this, but it's crucial and it's critical. But one other comment I have is that the one thing that I see, and this is going to be difficult, is that, sometimes that toxic stress that the mother is experiencing, it's stuff that's out of her control, whether it's relationships, whether it's economics, whether it's, so no matter, it's just a tough thing. This is a system thing. This is a social determinants of health thing. This is bigger than all of us, but I think there are some important first steps you mentioned. Changing the culture of showers, I think, is a big one, right? If we could change the culture just the way we approach it, I think I'm guilty of it, right? We're always like baby, 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 but 90% of that effort should really be placed on the mom, and sometimes dad isn't there, right? Let's acknowledge that the family unit is not always, it's not always nuclear. It's not always like what's in that picture. It tends to not be for so many. Anyway, this is just really, I'm just really excited to see this finally become.
Yeah. Thank you for sharing, Lupe. And yes, I think as we have evolved, California Health Club has been working on this topic since 2012. Doctors in the Central Valley are starting to see the parallels of your mental wellness impacting your physical health, especially in perinatal world. It's taken a lot of time and encouragement, but they are now realizing that, even if we put it in perspective of dollars, right? Because when an OB takes on your case of your OB provider, sometimes they just get a carved out amount. So if mom continuously comes to the doctor, he's not getting paid for each visit that you come to, or there's the fact of preterm birth. So they're starting to see the connection. Thank you.
This is Patty Havard. I just want to thank you, Alex, for an excellent presentation and also the comment made by the previous speaker or guest. One of the things that I did have the opportunity was to help develop the HIV high-risk pregnancy clinic at The Ohio State University. One of the, and I've been out of California for 28 years and I just came back. One of the challenges in Central Valley, many challenges, one is the shortage of providers. Second is the rurality. We're such a vast area and with very limited resources. One of the keys that I think we need to consider is how do we pull all the resources from such a vast square miles of Central Valley to help our clients. At Ohio State University, I was able to get OBGYN the pediatric department, the infectious diseases and pharmacy. And we had a medical center right across the street was the outpatient of our high-risk pregnancy clinic. Everything was so locally, in distance, in such a close distance that we were able to get the care rather quickly. But here in Central Valley, that rurality just makes it very, very difficult. And somehow I think that if we can compile resources, etc., where they need to go to get help, may be also something that is necessary. Thank you.
I think, to Patty's point, I think Nanette's on. I know 211, plays a role in that. And I know for HealthNet Calviva, we utilize the Aunt Bertha. So there's going to be a lot of social platforms. Selena, I don't remember what you guys are kind of pushing, but there's going to be a lot of social platforms. Really, I think that's the landscape right now. Is really trying to, but that's not a physical one-stop. That's just a virtual one-stop. But it's kind of the beginning. But yeah, I agree with you, Patty. I mean, yeah, ultimately, if we can get everyone to work together, that's going to help best. But
yes. And really connecting some of these collaboratives. So, I think Julie's aware of it, and Patty might be aware of it. We have county level coalitions. So we have a maternal wellness coalition for Kings County. We come together and work on some of these topics of, how do we best serve mom and baby? And then we have a statewide coalition. And so the statewide coalition kind of looks at each county and looks at their resources, looks at their campaigning. So then we can pull it down to a county level and not have to duplicate services. So if any of you guys want information to that or a calendar invite, George, I can get that for you. But again, you guys are doing the same work almost with the ACE piece, the screening that we are doing with perinatal wellness.
Alex, the health plans too are working with our providers and physicians on the Help Me Grow and developmental disabilities initiatives. I like that you spoke of the cognitive impacts on, baby's developing brain while mom is pregnant. I'm wondering, and I don't have the answer, so I'm asking the entire group, I guess, is how can we, twofold, I guess, package both ACEs and, developmental screenings, ACEs screenings, developmental screenings, other screenings that providers, we're pushing them to do, and for very good reason, right? But how can we communicate best, how they go together, how they work hand in hand? And I think that's what I would like to learn a little bit more about, not just for myself and to have, just to have a little bit more education on it, but so that we can help our providers also understand the importance of both.
Yeah, that's a great question, Selena. So HealthNet in San Joaquin County, they're working on some of those pieces with us, and they're packaging the ACE screen with the perinatal screen. And it's done during the pediatric visit. So I'm assuming, knowing pediatrics, that there's some sort of, cognitive development screening going along with it. I think that that's the best space when we're doing our physicals for our kiddos. But then again, how many kiddos don't get physicals? So a lot of work to do.
Yeah, some of that's not my hands.
I think I also wanted to share is I'm not too sure if these individuals was also mentioned, but are women that deal with a lot of infertility issues. I think that this is we cannot ignore them as well, or those that have had multiple losses and miscarriages and or stillbirths. We need to be, also very supportive of them. And I tell you that this is, even though that they are services for those individuals, they are part of this special population, and they continue to, because in the future they will want to be able to get pregnant again, and it's just all these symptoms do arise because of just the unknown of what can occur. And so talk about toxic stress, talk about all those different traumas they might have experienced during pregnancy and or labor as well in the hospital. We have to be mindful of that as well. So there's different components that we need to consider, and not just when they're pregnant or when they're in recovery, but also in between, before and in between post delivery.
Yeah, I mean, we could talk for days about toxic stress during the perinatal period. What comes up for me is, a lot of women will reflect on history of sexual abuse during pregnancy or post-pregnancy. So that's, again, another factor. DV increases during this time period, right? So the interplay between toxic stress and adverse experiences and perinatal period is overwhelming.
I'd also like to add, I think adopted families need to be incorporated into this as well.
Yes.
Even when you're talking about like the baby blues, the mommy, because lots of adopted families within my family, and even though they don't have the hormonal components that go with them, they still have that anxiety and possibly depression and things like that. And I can go on this big soapbox as to how what I think is connected, and I'd love to do research if I had the money to go do research. But I think that's also a component as well that may not get enough light. Yeah. Because that toxic stress of just the, even though adoption is very beautiful, it could also be a traumatic event that's connected. I saw someone bring up foster care parents, so that as well. That has an impact on that child that may follow them all the way through. So it not being addressed might be something, if we had more spotlight on it, it could possibly save a life.
Most definitely. It's very stressful. And then I go back to, I worked in CPS for many years, and I go back to the first experiences of these newborns, right? And so, they're dysregulated. They might be pushed from house to house, right? And then we have this adoptive family. Mom's in love with baby, but mom's nervous and stressed that the baby's going to be removed, right? So we looked at self-regulation. We looked at cognitive development. These are all pieces that need to be addressed during those first 5 years. But yes, thank you for bringing up adoptive parents, infertility. Those are great pieces. Anything else? Well, thank you guys.
Excellent. Thank you, Dr. Alex. At this point, please unmute yourself and give Dr. Alex a round of applause for her presentation today. Thank you. Very good. I'd like to open this up before we get to Kings United Way to do a quick round of introductions. So I will go ahead and I'll call your name. And if you could just turn your camera on if you're comfortable with that, and introduce yourself and the organization you're with. So to start off with, let's go with Lupe Wong.
Hello all, my name is Lupe Ponce Wong. I am with HealthNet Calviva. I am a senior health education specialist. I am the ACEs and behavioral health SME. I was actually formerly in Kings County as a behavioral health program manager, alcohol and drug program administrator. So I'm familiar with many of you. So I'm kind of glad to be back around.
Awesome. Thank you, Lupe. And that's what we're trying to do. We're trying to get everybody familiar with our network members. So in case you ever want to reach out to our other network members, you can go either through us or reach out to them directly. Let's go with Shannon Tolbert.
Hi, everybody. Shannon Tolbert with RE Community Health Centers, program manager for our Health Homes program, which will hopefully in the near future become enhanced case management through the county effort. And some of you may also remember me with being with Kings County. So same as Lupe, we bounce around a lot around here.
Awesome. Thank you, Shannon. Araceli.
Hi, everyone. I'm Araceli Castillo. I am here on behalf of Adventist Health. There, I'm a project specialist, so I'm involved with a lot of different initiatives like this that are usually grant funded and have a lot more to do with our community.
Wonderful. Thank you, Araceli. Hortensia.
Hi, my name is Hortensia Casares. I am a social worker at a SpearNet Foster and Adoption Agency, and I work with post-adoptive families in Kings County.
Thank you very much. Carson.
Hi, my name is Carson. I work at Family Healthcare Network. I am the Grants Management Coordinator. And yeah, we have a presence in our Hanford Clinic, but we are also in Tulare and Fresno County. So, but glad to be part of this.
Excellent. Thank you, Carson. Sarah Flores.
Yes, my name is Sarah Flores. I'm the program coordinator for Wesker Adolescent Services, and we provide outpatient treatment to adolescents ages 12 to 17. We're located in some of the high schools. Well, unfortunately with COVID right now, we're not serving the high schools, but we are still serving clients in our office via telehealth services.
Excellent. Thank you, Sarah. Carmen.
Hi, good afternoon, everyone. My name is Carmen Becerra, and I'm with Sequoia's Adult Education Consortium. So we work with the adult schools in Kings and Tulare County, and also community college. Thanks.
Wonderful. Thank you, Patty.
This is Patty Haver. Thank you so much for this wonderful network. I'm a research development specialist at Kauai Delta Healthcare District. I have over 32 years of pharmacy academia from assistant professor to associate dean. I came back to California about 6 years ago and have been just pretty much engaged in the Central Valley health needs and hoping to continue in my learning of ACEs, toxic stress responses, and building a community of resilience. Thank you.
Thank you, Patty. Rocio.
Good afternoon, everybody. My name is Rocio Arevalo, and I'm currently the program manager for Madera, Fresno, and Kings County, and primarily with maternal wellness. And so I'm glad to be part of this session today. So if you have any questions, I work directly also with Dr. Otto Watson. So feel free to message her or message me as well.
Thank you, Rocio. Thank you for being part of this network. Selena.
Good afternoon, everyone. Selena Escobar. I'm a program manager with Anthem Blue Cross Medi-Cal and supporting our Central Valley counties, including Kings County, of course, as well as our central rural counties in overall general Medi-Cal operations.
Wonderful. Clarissa.
Good afternoon, everybody. My name is Clarissa Ravello, and I'm the program officer for First Five Kings County. We don't necessarily provide direct services. However, if you need some information related to programs for children 0 to 5, any of the family resource centers within Kings County, please feel free to check out our website or email me.
Excellent. Thank you. Patricia Torres.
Hi, good afternoon, everyone. My name is Patricia Torres, and I'm here on behalf of Anthem Blue Cross Medi-Cal. I serve 4 counties, with one being Kings County. So I'm here to learn more about ACEs awareness, and also to see what other ways we could be of support for this program.
Wonderful. Thank you, Tori. Hassel?
Hi, I'm Tori Castle, and I'm with EMT Associates. We're a research partner. We've been involved with working with Clarissa with First Five and doing some work around home visitation in Kings County for a long time. We are going to be helping on the new grant with some of the reporting and development of the deliverables, so supporting the Health Collaborative in that way.
Wonderful. We've just got a couple more minutes. We'll make some quick introductions. Lori Booter.
Hi, I'm Lori Booter. I'm a school counselor for Lemoore Union Elementary School District.
Thank you. Renee Farias.
Hi, I'm Renee Farias. I'm a community nutrition advisor with Dairy Council of California. We're a nonprofit that provides nutrition education for children and families.
Excellent. Natalie Renscher.
Excuse me. Good afternoon, everyone. I'm Natalie Renscher, and I'm the library director, excuse me, for the Kings County Library. Wow, what an introduction there. I'm the library director for the Kings County Library.
Oh, bless you. And Gloria Balderas. Gloria, I'm a senior, Gloria is in the chat, says I'm the senior family resource coordinator for Kings County Health Department. I work with First Five Parent as teacher program. We work with families who have children 0 to 5 and or prenatal. Thank you, Gloria, for putting that in the chat. Sarah Sorensen. I think we're down to the last one. Sarah? And if there is anyone else, any member here, not a collaboration member, but any member here who has not introduced themselves.
I guess that would be me, George. I joined a little late and got messed up on the link, but Julie Lafise with King's Partnership for Prevention.
Excellent. Thank you, Julie. We're down to the wire here. I want to try to get everybody out of here as quickly as possible. We've got 2 things left to go. Erica, I'm going to turn it over to you. And we're going to do a 2-on-1 introduction.
Thank you, George. So good afternoon, everybody. My name is Erica Lopez. I am the 2-on-1 coordinator at Kings United Way. We also have Nanette Villarreal, which is the executive director for Kings United Way. And we were overseeing the community information exchange, and now we have Alexis Terrell, community engagement manager, who is now overseeing the community information exchange. Both are on the call. So I am very happy to serve as a representative for local resources offered in Kings County. Today I'm here to talk to you about 2-on-1 Kings County and a little bit about the community information exchange and how you can learn more about the technology platform. So 2-on-1 is a free 24/7 service that gives you access to community health and social services. 2-on-1 Kings County is a helpful tool for providers and patients to find resources such as social services, as well as resources to reduce toxic stress. We will be taking a deeper dive in the next slide on how you can access those 2-on-1 and the resources. For the previous slide, the Community Information Exchange, which is a technology platform that allows to make referrals and foster collaboration across networks. This helps improve health and wellness for individuals and populations by moving towards a person-centered care across healthcare and human services. Next slide, please. So it is extremely important to connect patients and their families to needed services. As a service provider, this is a very helpful tool you can use to find local resources. And if you have any questions, please feel free to reach out to me after this presentation. I do have my contact information available in the chat box. So we have a few different ways to access 2-on-1. All different ways to access 2-on-1 are free and available 24/7 and are confidential. When you call 211, you get connected to a live call specialist. Call specialists can provide information on local agencies providing services either over the phone or can also send information through text if you prefer that. When calling 211, each caller is offered a follow-up call to ensure that the caller was able to access services and to provide any additional resources if needed, if the caller agrees. Me and my team will then follow up with the caller. So you can also text your zip code to 898-211. When you text your zip code to 898-211, you will receive an opt-in message asking for age, gender, and reason for contacting 211. When you respond, you will then get connected to a call specialist that can provide information on resources. You can also search information on our database by visiting 211kingscounty.org. And you can either search for resources through categories displayed on our homepage, or you can also type in a resource through our search by text option, which we'll be going into a little more in the next slide. We also have live chat available. So in case you're having some issues, connecting with resources through our categories, or if you rather speak to a call specialist via chat, we have that available 24/7. And we also have a mobile app called 211 and Telephone, very similar to the website, both display categories. You can do search by text on both as well, and where the categories can help you find local resources, such as family resources, mental health resources, housing, and much more. Next slide, please. So here is a slide on some helpful resources available on our website, 211kingscounty.org. We have a variety of resources such as the ones listed on this slide, as well as other helpful resources, like counseling, support groups, hotlines, and things like that. In the next slide, we're going to have a short video demonstration on how you can access 211kingscounty.org, as well as categories available on it. Visit 211kingscounty.org and find information on local resources. You can chat with the live call specialist. You can also search by text by clicking here and typing in the resource you like. You will then get a list of different programs available in the database. You can also search through our categories on the main page. Click on the category of your choice and get a list of subcategories in both English and Spanish. Click on a program, get information such as description, phone numbers, website links, location, and program deliveries. So with the 211 resource, please keep in mind that we have 211 Kings County cards available in both English and Spanish. If you're interested in some of those to hand out, please let me know. As mentioned earlier, I will be providing my contact information in the chat box. Next slide, please. So Kings United Way has partnered with Unite Us to establish a community information exchange. The CIE is a community-wide referral system that facilitates connections across multiple agencies and links patients and their families to needed services. Through the CIE, you can access a resource database. Next slide, please. And the 4 core components of a CIE are network partners, shared language resource database, and bidirectional referrals, as well as technology platform and data integration. These core components come together to create a community care planning tool, as well as it allows networks to, or allows network partners to work together, share client records, access resources, as well as make closed loop referrals. Next slide, please. In this slide, we have some upcoming sessions on the Unite Us technology platform. So that's going to be our community information exchange. If you're interested in learning more about the community information exchange and how you can be part of it, I encourage you to join one of these sessions coming up. The link will be provided in the chat box where you will be able to register for one of these sessions. But if these dates don't work for you, I will also be providing Lexi's and Kendra's, who is with Unite Us, email in the chat box, and they'll be able to schedule a session that best works for you. Or if you have any questions regarding the community information exchange, please reach out to our team. I will also be including, as mentioned earlier, my email and phone number if you have any questions regarding 211 Kings County. Thank you.
Excellent. Thank you very much. We are a couple minutes over. We're going to go quickly to two things. I'd like to let you know that we have an evaluation survey that we're going to pop into the chat feature. We're also going to send to you via email. Please, 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 I'm begging you, take the evaluation survey, do the survey. It just takes a couple minutes, and give us some feedback on what you thought of today's session and our network. Lastly, we have save the dates. I'd like to turn this over to Linda Baggio, our program manager, to tell you a little bit about our upcoming network of care sessions.
Thank you so much, George. As shown on the screen, we have our upcoming next network of care session, which will be held on March 15th. We're extremely excited about this session as it will provide a community tailored training for ACEs awareness. So if you are wondering as a community member what role that you play and what knowledge that you can provide to your clients in the community, this would be a very essential session for you. So we really look forward to having you all there. Next slide, please. And before we jump into the raffles, as George has mentioned with the evaluation, if you all could please take the time, I will pop the link onto the chat. If you could please take the time to complete that evaluation. It really allows us to be able to build on our services and see how we can improve to best serve you. Thank you.
Okay, at this point, we have a raffle for those people who have attended today's session. I'd like to bring your attention to the spinning wheel at the front. Catherine Landeros, we have a winner already. Awesome. Thank you, Cameron. That was awesome. Thank you, Catherine, for being here. Even if you're not here right now, you will be getting a raffle prize. And we want to thank each and every one of our network members for joining us today. Again, the SurveyMonkey link to the evaluation is in the chat feature. We will be sending out a thank you email to everybody who attended today. Really appreciate you speaking out, introducing yourself. And remember, this is a network. We are family here, getting our ACEs information out and helping each other in any way we can. So keep us in mind if ever you need an introduction, if you need some support, and if you are interested in a presentation around ACEs at your area of work. We are happy to have that discussion with you and bring you the information that you need. On that note, I'd like, on behalf of everybody here at the King's Collaboration, to say goodbye, to say thank you for joining us, and to say I hope you have a wonderful, wonderful stress-free week.